I start by defining what is anti-aging medicine.
Yes, please, doctor.
It is a multidisciplinary new clinical field introduced by the American Academy of Anti-Aging Medicine in 1992 as a new paradigm in clinical practice. It concentrates on preventive medicine as well as a new approach to how to deal with diseases. And it goes to the root cause of the problem and not to treat symptomatically from one side. Then we have the other approaches in anti-aging medicine is personalized medicine, because the anti-aging physician respects the biochemical identity of the patient or the individual and understands well that there is a harmony and interaction between the different organ systems of the body. So we have to respect this harmony and to deal the whole body, not only one part of the body. As well, the cell is the unit of disease and health, and we focus on many different biochemical processes that go into the cell. After doing all these approaches, then we can build a customized long-term management plan or treatment plan where the patient is an active player, because without the good participation of the consumer, we will not be able to implement the treatment plan. One of the major advances done by anti-aging medicine is the realization that we age because our hormones start to drop after a certain age. And after a proper assessment of the level of the hormones, especially the sex hormones, and after knowing exactly how these hormones are metabolized in the body, because there are different pathways for detoxifying the hormone in the liver, then we can safely give hormones in a customized form. There is no one fixed dose that fits all. Hormones is only one part of it. There are other modalities that we really concentrate on it, because healing comes from different aspects, not only from one pill. This is one thing, and the second thing, we really concentrate on the fact that there are so many different repair systems in the body. We are going to enhance the function of this system. We want to make the innate powers in our bodies to work in a positive way. So we have 6 different modalities. On top of the list, we have the nutrition, which is key in the preventive and therapeutic medicine, because in fact the food that we eat contains bioactive nutrients that speak with the genes and will cause either expression of good genes or the expression of bad genes. If we have healthy food, healthy choices from different natural, unrefined, unprocessed, whole grain food, then we have the bioactive substances that express the good genes. If we have refined sugar, we are going to disturb the hormonal balance in our bodies, and the disturbance in this hormonal level, especially the hormones responsible for intermediate metabolism, will lead to a lot of diseases, such as coronary artery disease, diabetes, hypertension, because of the disturbance of the different hormones due to unhealthy food, which I just mentioned. Second thing, we have to pay attention to the lifestyles, and which is important. So on top of this, we have to control our stress, because we're living in stressful life, and we have to also concentrate on our spiritual life, family life, social life, because these are they add positively to the quality of life we are going to lead. Exercise is also important. It is the way how to revive our cardiorespiratory, to burn fat, and to maintain balance and good joint function at older age. Then we come to the fact that we need to do certain measurements to the different nutrients we have, vitamins, minerals, and to assess the availability of amino acids, the availability and ratio between different fatty acids, polyunsaturated and monounsaturated acids. And lastly, we have to pay attention to toxins because we are living also in a toxic world. We have to determine the toxic load and accordingly either we detoxify or we give the advice how to avoid toxins. In general, if we follow these different advices and have a regular visit to the healthcare provider, especially those who are well trained in health-oriented medicine, then this will pay off on the individual, on the family, on the society as a whole later on in life. The new techniques, and in this way we evaluate the different hormones in the body and the urine to evaluate how the body gets rid or detoxify or metabolize these hormones. As well, this tool we understand the strains, different strains in the gut microbes. We have to know the microbial profile because nowadays we consider the microbial profile as one organ of the body because of its huge influences, whether positively or negatively, on the metabolism of the body and the expression of genes in our body. After that, we do vitality studies, which mean that we assess the functions of the different organs of the body, the cardiovascular, respiratory, the musculoskeletal, the nervous system, etc. After doing all these procedures, it take time, 2 to 3 days maybe, we will have the whole picture of the body. How is your system functioning in health or disease? And we can recognize the defects or the diseases at this level. After recognizing the defects we have, then we start our proactive, customized, long-term strategy with the cooperation and complete partnership of the consumer, because he is the one who is going to do most of the things to sustain and maintain vitality and avoid occurrence of diseases.